Crohn's disease is a type of inflammatory bowel disease. It can occur anywhere along the digestive tract. If Crohn's disease is located in the small intestine, this has an impact to interfere with how we digest and how we absorb our nutrients from our food. It can also lead to symptoms of diarrhea because we're not able to digest and absorb our nutrients from our food. It can lead to other symptoms such as gas and bloating and pain, because undigested foods, once it leaves the small intestine and enters the large intestine, it can be fermented upon the bacteria there, leading to gas and bloating and other symptoms along that line. In order to cope with the nutritional implications that Crohn's disease inflicts upon us, there's a couple of tips that we can try. There's no need to avoid any food unless you're bothered by that food. So as an example, if you have a problem with digesting fat well, because that is digested in the small intestine, there's no need to go fat-free, but can we choose low-fat food options such as baked or grilled or steamed fish, or perhaps using a broth-based soup versus a cream-based soup. Another thing is how much you eat at one given time can play a role on how well you feel after eating that certain food. As another example, lactose and milk sugar, it may not be digested well in Crohn's disease because Crohn's disease may interfere with the enzyme's ability to digest lactose. So eat less dairy, spread out your dairy, treat dairy like a garnish, a small snack versus the main entree to help you feel better after eating dairy. If the location of Crohn's is in the small intestine, likely malabsorption will occur, and then we may need to supplement through the diet by adding foods or adding a multivitamin to help you correct those deficiencies. If the Crohn's is in the large intestine, it may not necessarily affect the way we digest and absorb our foods, but it can also affect the way we absorb water and electrolytes, because that is the primary role of the large intestine. If you are diagnosed with Crohn's disease, it is important to seek guidance from a registered dietitian that specializes in GI disorders. If the nutritional implications are not addressed, it can lead to deficiencies, it can lead to loss of lean body mass. The registered dietitian can help you determine what foods you can eat and how to eat the foods that you have problems with, and overall also help you reduce the symptom severity and to help you feel better overall.